Let us pray. Dear Lord, we thank you for the life that you have given to us. Yet we know that we're only sojourning in this earth, that our permanent home is in heaven. And yet, Lord, you have entrusted us with our life, with our health, with our resources, and Lord, we pray how we might be able to be good stewards of it, Lord. And we know that as we get older, that our health will decline, and there might need some extra care. So we're thankful for Karen giving us time to prepare for that, as to long-term care is an option that we might want to consider while we're younger, and not wait until we need it down the road. So we commit this time to you. We pray in Jesus' name, amen.
All right, thank you all for coming, and this is going to be a fun lecture. And if you have any questions, you can type it into the chat, as well as just ask live here. Please feel free to pick it up. And I'm going to have Amara do a few more handouts. I know they're in here somewhere. Let's see. Oh, that'll be perfect. Okay. Of course, as I always say at the beginning of each session, there's no specific recommendations I'm going to make. Nothing is guaranteed in terms of any investments or any product that you can purchase from any company. So you should always ask whoever you're working with to give you the information, give you the background, also let you know the pros and cons of anything that you make a decision to either purchase or to carry out. All right, but I like to start things off always with a biblical perspective. And if you think back in the early years, I know in America, in its early years as a country, pretty much all the hospitals started off as charity hospitals. So they were run and put in place by believing Christians who felt it was their calling and ministry to care for those who are less fortunate than themselves. So actually, a lot of hospitals actually have very Christian sounding names. If you think about it, that was the beginnings. Now it's changed over the many years, but I want to point to a scripture that's 1 Timothy chapter 5, verse 8. And it is, if anyone does not provide for his own, meaning his own family and loved ones, and especially for those of his own household, he has denied the faith and is worse than an unbeliever or an infidel. So even in scripture, God teaches us that we do take care of your loved ones and your own family. You don't ask someone to care for, I guess, your responsibility, if at all possible. It's not always possible, so others will step in. And hopefully that's I think the values and the principles that we can carry on as believers and as Asians. As Asians, that is a very strong thing in our community, whether they're, of our faith or not. But it was very, as I shared earlier in some sessions, in my mother's case, it was very important that we would never place her into a facility when she became incapacitated. It was, she made it a very clear point. So that was one of the 3 things that she required of us 5 children, which we were able to honor and carry out for her, since she let us know many years before she needed that kind of care, what her wishes were. And I hope your family will be able to do that too. So, who should care for your loved ones? Is it going to be you or someone else? And that someone else, are you depending on the government or a stranger or someone else to take care of your loved ones? Once you make that decision of who is going to care for your infirm elderly person, or even a young person that's has been incapacitated. When you have answered this, then you take action accordingly to follow up on your plan. Now, people who reach 65, and in general, has a 75% chance of needing some type of long-term care during their retirement years. And this is just done as recently as 2019. And we're seeing more and more people are living longer. And also, while many are very healthy, they also have a greater number needing some kind of care because of memory loss or something's not functioning correctly. Now, a lot of people think certain things are going to be paying for their loved ones' long-term care or their own long-term care. They think Medicare is going to pay for it. Well, that is not necessarily true. To qualify for Medicare coverage of long-term care, the person must have been in an acute care hospital setting for a minimum of 3 days. And that 3 days does not include your discharge day. So you have to be dismissed or discharged from an acute care hospital. Your doctor has to prescribe that you need long-term care through Medicare, and they will provide the nursing and the nurses and the aides and whatnot to care for you in that setting at home. However, it's limited to 100 days. And it's a sliding scale. So the first several days, they'll pay, X number of dollars. And further on into that 100 days, you pay more and more of the cost to the point where it is very, very expensive. So the coverage through Medicare is going to be limited. And again, most people don't think of that. Medicaid is another one. It is paid through the state. Medicaid, however, is a bit more challenging in that you have to spend down your assets to about $2,000. Your income must be a modest amount, like I said, $1,200 or $1,300, whatever the amount that they declare at that time. And you must go to a Medicaid facility that has an available spot for you. That was the old style. So whether, yes.
The asset that you mentioned, does it include the house?
Usually not the house, but the question was, does assets down to $2,000, did it include the house? Typically not, especially if there's a spouse. You don't want to throw him or out on the sidewalk. So they have to be able to live in the house. Usually it's like cash, life insurance, cash value, CDs, bank accounts, your valuables had to be down to $2,000. Oh, okay. Someone go find a missing child. And so you had to spend down $2,000. Your income, whether it was for Social Security or pensions or whatever it was, had to be less than a certain dollar amount. And I want to say it's going to be less than $1,500 a month. It's a rather modest amount. You also, there's a lot of what we call planning, Medicaid planning. I see that a lot where there may be fortunate people who have quite a few assets. So they start hiding the assets. They gift it to their children, or they put it under the name of somebody else that they, whatever. And so they still have control of it in certain respects. So the Medicaid provisions put in what we call a 5-year look back. So if you have squirreled away, say, $1 million of assets in the past 5 years, there will be discovery, and they'll be happy. The state will be happy to provide you Medicaid after you spend $1 million out of your own pocket. Then you can qualify for Medicaid. So usually I'll suggest to my clients, if you've already got the assets, if God has already blessed you with those, use it and take care of your loved ones that way. That way you can also choose where they are cared for and where they're housed. Now I understand on Medicaid, you used to not be able to do care in your own home under Medicaid. I heard that has changed recently, that there are provisions where you can be cared for in your own home, but you have to qualify for that. Long-term disability is something you will see probably in your own paychecks. You might pay some premiums through your employer's plans and have purchased additional long-term disability. That is not for long-term care. Long-term disability is only to protect your earnings and income only while you're working. So if you're retired, you're not working. You do not have long-term disability coverage while you're retired. It's only protecting your paycheck. So if there's no paycheck, no long-term disability. Okay, health insurance. People think that health insurance plans are going to pay for long-term care. That I have yet to see one that pays for long-term care. You might want to check your own health insurance plans, but I have yet to see one. There may be some, I kind of doubt it. So that's where most people think that long-term care would be paid through these four possibilities is probably 99.99% never going to happen. Now, home health care, 70% of people that need long-term care are in their homes. And most people, unless you don't love your family, most people want to be cared for in their own home when they're in that situation. So 18% will be in a assisted living or some kind of facility or institution, and 10% will be in some kind of nursing home care, or I've seen some where a family will renovate their home and be able to house up to 3 or 4 people to become almost part of the family, but they are cared for in that kind of a care home setting. Now, 89% of the families with loved ones are considered switching. Well, during this pandemic, and when we saw so many people grieving that they could not even visit their loved ones in the hospital or in the nursing home, whether they were passing away or not, and just really both sides were just grieving horribly. So many have shifted their thinking that should the situation occur for their elderly loved one, they would want them in their own home and being cared for by people who know and love them. So we've seen quite a big shift in this respect, especially during this pandemic. Okay. Now, the Wall Street Journal just came out on the top quote, the pandemic has really reshaped the way Americans and people living in America care for their elderly, and it's really prompting family decisions to avoid the nursing homes simply because of what we saw happening to the ones that were in the nursing homes. They were dying, they were isolated from their loved ones, even the families were not able to visit, and things were just not done to the liking of anyone in the family involved. And in a recent study of the family caregivers, 2/3 of the respondents said, again, the COVID-19 really completely changed their opinion about the best way to care for their elderly adults. And they would rather have them in-home care rather than some kind of facility where they may be prohibited from visiting or even caring for them. Now, what's the definition of long-term care? In Texas, because they may be different. If you're in California, if you live in California, it's a little bit different. They have a little bit more stringent rules. But here in Texas, it's defined as you have to, well, there are 6 activities of daily living or 1 mental incapacity. To qualify and trigger the use of a long-term care coverage policy, you have to not be able to do 2 out of the 6 activities of daily living for more than 90 days. And it's your physician, not anyone else's physician. It's your physician writing a confirming letter or document saying that, yes, I think patient XYZ is going to be in this condition beyond 90 days, and they qualify for long-term care coverage if they have a policy or something. Or if they are just mentally incapacitated, that one item, that one condition will trigger long-term care policy coverage. I know in Texas and a lot of states, but again, California may not allow that. In other states, you would have to look at the rules of the state that you live in. Now, what are the?
What physician? You said that it has to be approved by, determined by what?
By your own physician, by the physician of the one that's incapacitated. The question was, whose physician? It is going to be the physician of the patient.
Is it like family practice or?
The question was, is it a family practice physician? It's whoever your physician is, you're a medical doctor, that they have determined that the person is truly going to be in this probably long-term situation, incapacitated mentally or physically, beyond 90 days. And their letter says, I, Dr. So-and-so, said, patient XYZ has, Alzheimer's or, a stroke and physically incapacitated. In their medical opinion, that person will need long-term care. And that will trigger when they present that letter to their long-term care carrier or whoever has that long-term care coverage is holding it, that should trigger the use of it, that benefit. Now, the 6 activities of daily living are going to be bathing yourself. So you can't bathe yourself. You can't feed yourself. You can't dress yourself. You can't transfer yourself. That's like moving yourself from bed to chair or going from the table to, do something, just move, transfer yourself somewhere. You're incontinent. In other words, you're either doing number 1 or 2 all over the place indiscriminately. So that's incontinent. And number 6, you have to wear the adult Pampers, so any 2 of those that last beyond 90 days will trigger the long-term care coverage I know here in Texas and the policy that I've seen. Okay. The other one that will, one mentally incapacitated condition is where you have some kind of brain damage or stroke, a trauma. You could have a car accident and or you fell and you injured your brain. Parkinson's, that's another good one. They start hallucinating all over the place and doing just 8 irrational sounding behaviors. So any one of these that's going to last more than 90 days, and your doctor or the doctor of the person says in their medical opinion, this will last beyond 90 days, and they certify it that way, that letter sent to the policy, the carrier of that person or the insurance coverage will trigger the benefits to make claims. But again, I'm going to report and just say it must be expected, this condition must be expected to last more than 90 days as determined by your physician. So it's not the physician of the insurance company, it's not the physician of whatever or your employer, it is the physician or your own physician that would declare that. So in my mother's case, after she became kind of goofy, leaving the water faucet on, turning on the stove and walking away. Grandma used to cook things at her stove. I mean, she's a great cook. But then she would forget and the whole thing would burn and she was so embarrassed that she would hide the burnt pots under her bed. So every day when my auntie came home, she had to check under my grandmother's bed to look for burnt pots. So when that happens, you kind of know you're triggering most likely a claim if they have a long-term care policy or coverage. All right. All right. There's a handout. There is a handout. It's called Ways to Pay for Long-Term Care. I don't know if you can see this. It looks like that. And I'm going to go through that, kind of the pros and cons. Here's how many people all over the world pay for long-term care of their loved ones. They self-insure. That is probably the most inefficient way to pay for long-term care. And I'll show you in a little bit, an example of why. Self-insurers where you just pay out of your own pocket, dollar for dollar. Some people will say, well, they'll just use their 401k plan monies. That's rather inefficient because if you let's just say you have $1 million in your 401k. Well, when you take out, let's say, the average in Texas right now in middle level care, nothing fancy, you're looking at about $80,000 to $100,000 in 1 year. If you want your hair done, if you want to have a little extra, fingernails done, and you want to have a little extra, you pay extra out of your own pocket beyond the $80,000 to $100,000 a year. So to take something out of your 401k, you could do that. That's an option, or somebody else's 401k, but they're going to have to pay taxes on it. So you're not going to get dollar for dollar. And also, if you're using someone else's 401k monies, because they're forced to, there's no other recourse, you've just sort of you're depleting their potential future retirement needs. So that's something to think about. Now, if it's your own 401k, that's your choice. But again, it's rather inefficient. Plus, if the market continues to be very volatile, you never know where the stock market will be at any point in time. So if the market takes another downturn, such as 2008, with what 40 to 60% of the value was lost in the 2008 market for a number of people, that really made it very difficult to not only pay for long-term care, but they have basically taken out a lot of their own future retirement needs, or for their spouse. The other one is relatives are going to help pay. I don't know about that. I have yet to see in any family, and all the ones I've worked with over the years, they either don't like you and they're not going to pay a penny, or they're not financially able to, even though they love you dearly, but they don't have the financial means to pay for you. Or they're what we call the sandwich generation. They're also raising their own children, putting them through college, and also trying to prepare for their own future retirement. And I have seen situations where loving children, adult children, will use their monies, or sometimes the parent will actually use their retirement money to pay for their adult children. I'm going, I don't think that's the best idea at this time, but that's your choice. So the relatives paying is not always the best option. Either they don't like you, or they don't have the means to pay for you, or they might like you, but they just don't want to pay. The next one is Medicaid. I think I went through that earlier. You have to spend down. You're going to have to spend down quite a bit. And also there's traditional long-term care policies, which I will talk about a little bit more in a couple more slides. There's hybrid life insurance plans that have long-term care riders on them. And there are other products such as annuities where they can put a rider on it that you can use it in long-term care, but that is not as efficient as people think. And I will explain that in a little bit. Okay, we already kind of looked at that. Here, traditional long-term care plans, if you look at your handout, there's pros and cons. This was the gold standard for many, many years in the industry. But what's happening is that when they did their calculations and scenarios, they underestimated how long people would live, and they underestimated the cost of long-term care, and they underestimated how the market was going to perform for the long-term care companies to be able to provide the funds to pay out claims. So what has actually happened here in Texas, and I've seen this myself when I do sell a number of different types of long-term care coverage, the traditional policies, those companies are pulling out of Texas. They've pulled out of a number of states, and they no longer sell new policies in a number of states because they can't afford to pay for claims in the future. A number have gone out of business. Existing policies for traditional long-term care are still honored that's number one, if you need it. Number two, if the company's still solvent and exists and hasn't gone broke. So that's another concern for any company, for any investment, for any product that you may purchase anywhere. Now, the good things about it is you can use the coverage oops, that's not the right one. You can use You can use a traditional long-term care policy on that handout. You can use it at any level, whether you're in your own home or you in your facility, daycare, assisted living, nursing home, whatever. And that's fine. Also, you don't necessarily have to wait for a 90-day elimination period. You can actually pay a little extra and in the premium. And as long as your doctor has declared and certified that you need long-term care, they will make the benefit claim ready from day one. So when I purchased mine, oh my gosh, I can't remember, 20 years ago, I can't remember, because we have such a strong family genetic history of Alzheimer's in our family. Uncle was, what, 10 years? And auntie had to lock him up in the bedroom because he would somehow get out of the house. I don't know how they do this, but he got out of the house multiple times, and he would find a bus to ride on, and then he would start riding all over town. And my auntie had to go and drive around town in her car and go figure out where the heck Uncle was. So finally, she just learned to lock him up in the bedrooms. That was kind of sad. Now with my mom, hers was 17 years of severe Alzheimer's, but it was in a way a blessing in disguise that she was a type that never moved. So she was in her own bedroom in a hydraulic bed that goes up and down. And we cared for her for 17 years. And she didn't want to do anything physical. I mean, if I held up a tennis ball and said, hey, Mom, we're going to squeeze this ball for exercise, you do it. I said, Mom, I don't need the exercise, you do. You know, so, but she was a type where it was easier to take care of because she didn't get out of bed for 17 years. Okay. And we had to make provisions so she never got pressure bed sores. So I thank God my younger sister took such good care of. She never had a single bed sore in the entire 17 years. And the nurses and aides that we would bring in and hire in, they couldn't believe that her skin was still like baby soft and pink and clean and just really good. I thank God for my sister for taking good care. So when I would go and fly in and take care of Mom for the 2 weeks while sister and her family went on vacation, I just hoped I could do as good as what she did. Okay. The other good thing about the traditional policies, you can have an inflation option because I doubt that the cost of long-term care is going to go down or stay the same as it is today. It's going to go up. So you can build into it, you know, like a 3% simple or 3% compound, 5% compound, whatever. You can pay that little extra so that over time, your benefit will grow. So when I purchased mine 15, 20 years ago, I put all the bells and whistles on, let me tell you. I made the highest inflation, it was a 5% compound. So since that time, when I purchased it, the benefit has doubled. So what I'm trying to do is keep up with inflation. Now, I may not pay for everything, but it will pay for a lot. And then my brother and sisters or whoever's going to take care of me or oversee my care, they'll have to break into my retirement plan monies or my other things that I have set aside so they don't have to dip into their own pockets. The negatives about traditional long-term care policies in most cases is use it or lose it. Now, I should say, not that I want the brothers to pass away quickly, but in general, once men reach 65, the probability of them using long-term care drops drastically because they live up to 65 and then they live up to whatever years and then they just pass away real quick. They don't go beyond the 90 days. So mostly when you look and visit nursing homes, you'll see like 3 to 5 women and 1 guy puttering around. And it's a very common sight in those care facilities. So if there's a decision to be made of who to cover first, I will typically suggest you cover the woman first because her probability of needing it is going to be, in general, more than the man. But you never know for sure if that guy, that husband is going to be that one out of so many times that is going to be the one that triggers it first. So use it or lose it. If you never use the benefit, you get nothing. Okay, so it's kind of like car insurance or home insurance. If you didn't burn your house down or you didn't have a car wreck, all the insurance premiums you paid for the car and the home insurance, you don't get anything back. You just had the protection for that time. So it's use it or lose it. This is a reimbursement policy. When you have the condition of needing long-term care, someone in your family has to pay out of your pocket first, save all the receipts, and then submit it for reimbursement. Now, some families find that to be kind of a headache, but it must be done in order to get some kind of reimbursement. The other thing is that all the receipts that are submitted to the insurance carrier will be filtered. So they will look at each cost, or each receipt rather, and see if it qualified by their definition of long-term care. If they don't agree with it, they will not reimburse you for that piece. So that can be discouraging for some people. The other thing that makes this a little more costly is that you can only use these traditional plans, for most of these traditional plans, by recognized home health care givers, providers. They are trained and licensed. So you can't hire, your adult child or some trusted friend or whatever to care for you and pay them whatever you agree on. So you have to hire and use people that are trained in this field and industry. So in my mother's case, even though my mom did not have a long-term care policy, because we had looked at what she had looked at in the early 80s. And in those years, those policies were very restrictive. You had to be housed in a Medicare facility somewhere that you may or may not like. And her benefit was only for 2 years. And the cost at the premium at that time was like $20,000 to $30,000 a year. And she decided on her teacher's salary, no way she's going to buy that thing. So we became her long-term care policy. Now, for when you use trained and recognized caregivers, that basically doubles the cost, because you're paying the overhead of the company that is sending the home health aide or caregiver to your home, and then you're helping pay for that person's salary. So it does tend to cost much more than if you hired someone privately. Okay, probably one of the worst things is the premiums in these traditional long-term care policies are not guaranteed. And it should say so in your policy and your proposals. They are, my experience, because I know the industry, they're pulling out of the business. A lot of them, they can't afford to pay ongoing care or costs for people who are not dying like they thought they would. So the premiums, my experience is the premiums are going to, well, mine went up twice already. Mine went up 40%. So about every 7 to 10 years, the premiums will go up about 40% is what I'm seeing. So that's another, and you pay for life. That's the other thing. You can't not pay. You got to keep paying for life, whether you use it or not. If you stop paying, what happens is they kind of turn it into a paid up thing, and you might only get the benefit of the actual number of dollars you paid into the plan. So if you have a policy, you need to check what your benefit might be. If you stop paying, you're basically decreasing your benefit. So always check what you have. Okay, the next one is life insurance. That's in the handout, item number 5. It's life insurance with a long-term care rider. This is what we call hybrid plans. And this is the one that is getting to be much more popular in the industry, since the traditional long-term care carriers are kind of pulling out of the business or just decreasing the amount of coverage that they're going to provide. This one is the nice ones about it. It's a use it or use it. You're going to either use long-term care or you're going to die. Or you're going to do both, or you're going to get raptured out of here, then who cares? So if we get raptured out of here, we don't care. But it's a use it or use it. The premiums are locked in. The pricing is already built into whether you pass or whether you use long-term care. So the premiums are going to be locked in and basically guaranteed. The inflation option is available. It just increases the premium accordingly. This one is very nice. It's called an indemnity plan. An indemnity plan is not reimbursement. Indemnity says it's not a reimbursement plan. You don't have to submit any receipts. Once that doctor's letter goes to the carrier, the insurance company, and says you need long-term care, they will just start sending money wherever you tell them to deposit. You mail a check, direct deposit to your bank account or whatever, and it's immediately available for use. They will not check your receipts. They don't want it. They don't need any more paperwork, because they know they're going to pay out a certain amount of money anyway on this plan. So that's a really nice thing. And you can use it. You can use it for any level of care, same as a traditional. You can use it in your home. You can use it in a nursing home, adult daycare, assisted living facility, or wherever. One more thing nice about this one, which I did not put on this, but you can add, you can pencil it or pen it in. You can hire anybody you want. So, and you negotiate what you're willing to pay and what the person is willing to accept. I know here in Texas, a number of people that kind of live near the border, I'm not saying anything, but they would have people live in their homes. And those people came from very modest situations. So they basically got home, they have a home to live at, and they would take care of the loved the person, and they would pay them whatever rate that that family agreed on. So it was a win-win situation for many of them. So the only thing that you have to prove, though, in either long-term care traditional or the hybrid plans, is that about once a year, probably, you have to prove that the person is still alive, because you don't want someone to get knocked off, like the Social Security recipients, that they get knocked off and someone else is collecting those checks. So you do have to provide proof that the person is alive and still in that condition. If you have a hybrid plan and the person recovers, then you can just contact the carrier, the insurance company, and say, hey, just stop the payments for now. And the money or the assets will still stay in that pot for that person should they ever need it again. If they never need it again, well, then when they pass away, they'll get the balance or whatever is still left in the policy. The negative thing about this one is that it only covers one person. Okay, so whereas the traditional one in item number 4, it's a shared policy where you can actually marry a husband and wife's policies together. So if in a traditional plan, and typically in a traditional plan, normally only one person of the couple needs long-term care. The other one just basically works himself to death and dies soon after, is what I've seen, caring for their loved one. So in a shared policy, you can marry the 2 policies together of the husband and wife. And if one of them uses it all up, they can now tap into the other spouse's one and use all of his or hers. And should the other spouse then need it, well, then you'll just have to figure out how you're going to pay for that. Okay, for the hybrid plan, there is no elimination of that 90-day wait period. You have to wait the 90 days typically. And again, most traditional policies, you basically self-insure for the first 90 days across the board anyway. Yes.
For the pair of, do the husband and wife sign up together?
Yeah, the question is for I guess the shared care policy, do they sign up together? Yes, typically when I do applications for spouses and they both do it, you do it at the same time. So they're getting the same plan. And this actually happened with a couple I had, I think I did theirs like in 2004, 2005, and loving couple, very wonderful couple. Unfortunately, the husband developed Parkinson's probably about 7 years ago. And his wife would be working, and then he'd call her on the phone and say, the house is on fire. And so she would, the wife would call the neighbor and say, is the house on fire? And they said, no, your house looks just fine. But it was the husband. Oftentimes when they're on medication, they're hallucinating. And it's not an uncommon thing to happen. So unfortunately, and he was getting very forgetful. So when he was paying the household bills and cleaning the house, after he passed, the wife was finding all the stuff he squirreled and hid away that he had never done. And so she's now kind of clean up. He passed 2 years ago. She's still finding things, and she goes, oh dear, how could you? So she's finding all these little things that he had not been able to accomplish because he was forgetful, he was hallucinating, and I'm sure he was doing his best, but he just couldn't function mentally. All right, So I hope that answered your question. Yes, you, at the same time you have it, you do it together for husband and wife. And then when the wife or the husband passes, the surviving spouse then acquires the benefit from the other one, and it piggybacks onto theirs and doubles their benefit. And so that's exactly what happened in this case. The wife now has double the time with the inflation option that's growing her benefit. And so she was just so thankful because if now she's a widow living alone. She's got 3 grown sons, but they all live away. But she has the means to at least pay for some of her care if she ever needs it. And honestly, we all thought she was going to go first because she was not in the best of health, but didn't happen. Her husband went first. Okay, item number 6 on that handout. There are tacking on a long-term care rider on something like an annuity. It's a use it or use it. So obviously, if you use it, that's fine. If you pass away, then the beneficiary gets the balance of whatever you didn't use. The premiums are locked in because you already paid a big chunk of money up front to purchase the annuity, so that's done. And again, you can use it at any level of care. Now, the negative things about it, it's a reimbursement type coverage. You have to pay for things first out of the pocket of the person, and then submit it for being filtered and qualified as, yes, this is long-term care costs or not. And then the insurance carrier will then reimburse what they feel is a appropriate type of care cost. This one has a larger upfront money. In other words, if you have like $200,000 to purchase the annuity with the long-term care rider, you got to come up with your $200,000 versus spreading out the premiums over, say, 5, 10, 15, 20 years or over your lifetime. So for some people, it's a little harder to come up with that big chunk of money. Also, the negative part about it is it comes out, the gains are what's income tax free, but you're using after tax money. So it's not the most efficient way to cover for long-term care, but if that's all you have, it's better than nothing. Now, this one here, the effects of the long-term care costs in 1 year. Over this past year, actually, it was assisted living costs in 1 year went up 6.15%. Home health services, just to clean your house, cook for you a little bit, whatever, went up about almost 4.5%. Home health aid services went up about 4.35%. Private nursing home rates, private room was up almost 3.5%, almost 4%. Semi-private went up by 3.24%, and adult daycare rates went down 1.33% because most people were keeping their elderly at home. They did not want to put them in the nursing home or facilities because they didn't know if they would be prohibited from visiting or coming to visit or anything, or helping take care. So that's what we've seen happen just because of what the pandemic has really changed the way we address long-term care.
Why did you have an asterisk on that?
I'm sorry, the asterisk is there, but the footnote got cut off. I'm sorry, I thought I got it all in.
What's it supposed to be?
Oh, that means it was just a reference where I got the numbers from. Yeah. When you're in the research industry, you always footnote everything. So, so that's where that asterisk, it meant something.
What is an adult daycare?
Oh, it's adult daycare is like you go to work, let's say, the husband and wife go to work, but mom or dad, you can't have them at home because they might start burning things on the stove or turning on the faucet and flooding the house or wandering off. So they will drop them off at an adult daycare.
Just like a kid.
Just like a kid. Well, like doggy daycare. That's another one. I see a lot of doggy daycare. They play with a lot of dogs. So that's adult daycare. And then at the end of their work scheduled day, they come and pick up their mom or dad or their grandma or grandpa, whoever it is. Mm-hmm. They should do adult doggy daycare with adult daycare. That would be really fun. But I've seen where they do young children with the seniors, and they bring them in and let them integrate together. And it's wonderful to see that. They really get livened up. It's wonderful. So they have like an adoptive grandma or grandpa. Okay. Okay, why purchase now? And I've seen this happen enough times in my 22 years in this industry. People will wait for any number of reasons. They're hesitant. They just can't make a decision. They feel that the cost is going to be too much. But what I've seen is the cost will never go down. So if you're going to purchase, you might as well purchase sooner than later. And honestly, the older you get, the more it costs. Just age alone will increase your premium significantly. By the time a person hits 60s, 70s, if you don't have your plan in place in your 60s and 70s, it's going to be very cost prohibitive to try to purchase one at that time. And then they limit the amount of coverage to maybe 1 or 2 years. It's very cost ineffective is what I've seen. Also, not only are you getting older and it just costs more, but you now may become uninsurable, where you develop a condition where they will decline you because you've now developed some kind of physical incapacity where you cannot do 2 out of the 6 activities daily living, or you become mentally, you lost it. You can't function mentally anymore. And it's very interesting, the questionnaires that I've seen that the applicant has to ask is, the typical things like, do you use oxygen? Do you use a cane, a walker? Are you, how are you driving? How many miles a year do you drive? Are you living with a spouse? So they're going to ask those things, but they're also going to ask your medical history. If you have Alzheimer's, if you have any other brain dysfunction, and it's very easy to pick out. And then they'll ask you memory questions like, okay, who's the president? And what's the dates today? And they'll ask you some historical things and okay, I'm going to give you 2 words or 4 words. And later on, I'll ask you what those 4 words are. And then I want you to make a sentence. And if you're losing your memory, let me tell you, you're going to fall on that one. So they will screen an applicant quite nicely, and you will be declined if you fail a certain percentage of the questions. And as you can see, the application declines are going up on the traditional long-term care policies, especially between 2012 and 2019. And here I did get asterisks with the little symbol down there. So that's where the reference footnotes are from. These are coming in from 2019 and 2020. The below, it's getting quite significant. Below age 50, they're declining almost 300%. They're declining. So 1 in 5 is declined. Between ages 50 to 59, they're declining 57%. Again, 1 in 5 are declined. Ages 60 to 64, 1 in 4, or over 1 in 4 is declined. 65 to 69, over 1 in 3 is declined, and age 70, about 1 in 2. So you see, the older you get, they're declining more because either it's so it's not cost, they can't qualify because something's going on. So they will not be able to qualify for their policy coverage. So that's why I'll suggest people will ask Karen, what's the best age to apply for some kind of coverage? I said, well, last year, somebody said last year, that would be nice. If you have a genetic history in your family of Alzheimer's, Parkinson's, any of those things in your bloodline. So if you're adopted, you don't know. Okay. And I have a number of clients that are adopted, so they don't know. But there are, like in my family, we have strong blood history of Alzheimer's on my mother's side. On my father's side, we have cancer, heart attack, diabetes, so kidney disease. And then my mother's side, not only Alzheimer's, but diabetes, kidney disease. So we got it coming in for both sides. So that's why I bought mine many years ago. And I forced my 2 sisters to get theirs. So you really, again, to answer the question, when should you get, if you have a history in your bloodline of having those kind of conditions, I would say you probably want to get it in your 40s, possibly your 50s. By the time in your 60s, it's going to be, either you're going to be declined because something's happening medically, or it's just too costly. So if you can stretch out the payments over a longer period, because you can pay, like if you had the ability, you could pay in one big chunk. A lot of people break out their CDs that are doing pretty much nothing in the bank, and they'll just do a 1 lump sum and be done, one and done. or they'll pay it out over like 5 or 10 years, or they'll pay up to 65, or they'll pay it up to 100. But if you do the math, the most cost effective is the sooner you have the money up front and paid for, over time, it's the less dollars, but it may make it difficult, for your cash flow. So it's really specific to your situation. But in general, if you're pretty healthy, there's no strong history of needing long-term care in the family bloodline, probably for sure in your 50s and early 60s is when you want to look. Beyond that, it gets much more costly, and then you may become uninsurable. I had one, her father had Parkinson's, and she was a nurse. She was a head nurse up in the medical center. And she was only like 40 something years old, but her father developed Parkinson's quite a number of years early on. He was able to function. He lived alone, but he had purchased a small little policy, like $1,000 a month for a couple of years benefit. They were so thankful because when they realized that he had that coverage, they used it to pay a lot of incidentals for him. And then he passed. So after her father passed and the dust settled, and the estate was settled and everything like that, she came over to me and she said, Karen, I want the biggest policy you have that lasts for a lifetime. So I said, and she was 40, not even 45. I said, okay, let me look. And so we were able to purchase a traditional long-term care policy for her. I put on all the bells and whistles. I put on the 5% compound. She was not married, so didn't have a shared care. And then we put the nice inflation, and then it was a lifetime policy. The following year, that company pulled that product. It's no longer sold. You will not find a lifetime policy probably anywhere now, because they can't afford to pay for you for life. So by fortune, she got that one. So hopefully she never uses it, but if she does, then she has lifetime coverage. She got a pretty significant policy too. Okay, I think, yeah, and this is just an example of what's, because I know some people like to run the numbers, and this is just an example. It's not exactly, in terms of the computation, but I want you to just think the concept through. What is more cost effective? Self-insuring versus shifting the cost to the carrier to pick up some of the cost. For an example, if you have $100,000 in a 401k that you section off for that, okay, that's a possibility. But to remove that out of your 401k, if you're not 59 and a half yet, you'll pay a 10% penalty. Plus you'll pay income tax that is stacked on to whatever your earned income, whether you're single or married filing jointly, for a tack on another $100,000. So you'll pay that income tax rate also for that year. So in other words, if you're in a 10%, let's say you're younger than 59 and a half, you'll pay a 10% penalty. You just lost $10,000. Okay, and then let's say you also are in a 20% tax bracket, you lost another 20%, 20,000. So instead of having $100,000 to pay for towards your policy coverage, you now have 70,000. So it's a possibility, it's an option, but it's not the most efficient. If you have $100,000 of cash, that's an easy one. You get $100,000, we'll purchase you your $100,000 worth of your coverage if your premiums, especially if you paid it in one time and one and done, you could do that. That's probably very, very good. No, I'm sorry, that one is if you just had $100,000 of cash. Oh, I'm just going to set aside $100,000 of cash. Well, if costs don't go up over time, by the time you trigger it, $100,000 might last you 6 months to a year. Then the question will be, where will you get the rest of it if you live beyond that 1 year? So that's a very inefficient way to do it. Then some people will say, well, I have land, I have a rental, or I have other real estate, I'm going to sell that. That's another option. But I know from experience, when I sold my mother's 5 acres of land in California, it took me 2 years. Plus I had to pay the upkeep and the taxes and all that stuff during the 2 years. I had to pay 10% commission to the broker in California. And then we had to pay tax on the gains of the property because Daddy had bought that thing like 40 years earlier. So it appreciated quite a bit. So by the time we got the money out of that sale of the 5 acres, we probably had maybe 60 to 70%. Again, not the most efficient way. Same with the house. Now I'm seeing in the market is the market was very hot. The real estate market was very hot in Houston and Texas and all over. But now we're seeing that the real estate market is kind of slowing down quite a bit. And plus you have to pay the commission to the brokers. You're going to pay for the upkeep and maintenance and all this stuff until you sell it and fixing it up. So again, that's not the most efficient way to do that. If you purchase just with $100,000, just paid out the premium one time with the hybrid policy or what, that turns out to be probably the most cost effective that I've seen in all the years that I've done this. Typically when I help a client and they essentially puts $100,000 of premium over the period of time, I've seen it leverage up the benefit to about $300,000 to $500,000 of benefit. And then everything comes out tax-free from the policy. So that's a nice thing. You don't pay tax, it comes out tax-free. Okay. Oh, now we're going to turn to another handout or attachment that you may have had. It's called the Healthcare Long-Term Care Cost Assessment Fact Finder. This one will help you if you want, you can or you don't have to. On the top section, you fill in not your name, you fill in my name, Karen Ho. Okay, that's for the report requested by Karen Ho. Okay, and I'll fill in all the rest. Then you put in your name. If you have a spouse, you put in his or her name, the gender, current age, retirement age, and the state and county that you live in. On the back, there used to be a whole bunch. You used to have like, if you just say like Sugar Land or Harris County or something like that. But if you plan to retire outside of Texas and you live in like Los Angeles County, then you put California, Los Angeles County or whatever. Just write that in because different geographic areas cost different for long-term care, as is with pretty much all living cost expenses. Where you live makes a difference in the cost of everything. So you can just fill that in, and then there's a section that says, they're going to ask something about your health for you and or your spouse. If you have a spouse, do you have, blood pressure problems, cholesterol, diabetes, heart disease, cardiovascular disease, multiple sclerosis, you use tobacco. I hope if you're using tobacco, including vaping, that you will no longer do that. Then because that is a big no-no. Okay, that is a real deterrent and it makes your costs go up for everything you can think of. Plus your health is not good. And then you put in your annual income that you anticipate in retirement and just kind of circle or check off those. And then you have my email. It's HOK@GWNsecurities.com. So HOK@GWNsecurities.com. And if you scan email this to me, I will have it actually analyzed. And it's going to be specific to you and or your spouse, what your costs could be for healthcare costs as well as long-term care costs. And I'm going to okay. Yeah. So I will have it costed out for you. Now, what the Zoom people don't have is this booklet. I couldn't attach this. This is really hard to attach. So we have a bunch of hard copies, which will be available for you if you come to the reception desk, after English service or whatever, or between services. And I'm sure Amara or Holly Chen can provide one of these for you. But in it, it gives a sample of an analysis for this husband and wife, and it gives, here, that's what it kind of looks like. Jim and Linda Smith, it was done January of 2019. Okay, so you put in your information, your name and all that, put my name up the front and, email it to me, and then just scan it in. And what it's going to do, it will print out a report, which I can easily email back to you. It's going to show, based on your information, what the average cost will be for you and or your spouse over time. So in this case, this is like and this is just an average annual cost in general over time for healthcare costs. In my opinion, this is way too low. It's going to be, my experience is in a home family kind of care setting, I'm seeing the cost right now between $2,000 to $3,000 a month. If you go into average level care of a nursing home, the average right now is probably about $6,000 to $9,000, $10,000 a month. If you're in a memory care, you're looking at assisted memory care. That's like Alzheimer's care units. Right now, and in fact, prior years, it was $10,000 to $15,000 per year. And if you understand or remember that the average length of Alzheimer's is 10 years. So if my mother was 17 years, my uncle was 10 years. So if you're very long-lived and you have some kind of memory loss like Alzheimer's or stroke and you live a long time and you're in a memory care facility, you're really looking at $10,000 to $15,000 a month. So I think these, to me, these numbers are rather low. Or either that, they're not taking very good care of you. This one, okay, for Jim and Linda Smith, their report came out that for the annual long-term care costs, they kind of, depending on what year they triggered it. See, now this looks more realistic. If they had used long-term care in home health or assisted living or nursing home care, you'll see that home health was about $27,000 a year. For assisted living, that was about $50,000 plus a year. And if they're in a nursing home, it was about over $83,000 a year. And that's just in 2019. If you put the inflation into it, by 2036, their costs have risen quite significantly, going to about almost $40,000 in home care, $83,000 plus in assisted living, and $150,000 per year now. This is per year in a nursing home. So if you trigger the need in 2036 for them, it would have been quite expensive. And if they waited until they triggered the use in 2046, you can see how the cost is basically pretty much more than doubled across the board. So again, it's probably better to purchase your coverage now and then cover for something like that. And then in your report, which, sorry, kind of cut off on the top, but it actually will also estimate in the report, you can see that, the Medicare Part B premium costs and the supplemental and Part D costs. It actually factors all of that in so that you can see at the end for the year or for the husband and then for the wife, what their annual average cost would be per year for those different costs, whether it's Medicare Part B premiums or Part D and supplemental gap plans, and then for the additional costs for healthcare costs. And just the healthcare, now this is not the long-term care cost. This is just to pay for your health insurance in your retirement, whether it's Medicare, probably Medicare. So they're looking at quite a significant amount. For the wife, Linda, it was going to be like almost $400,000 or $500,000 by the time it's all said and done between the husband and the wife. 300 here for Linda, Oh, this is her Part B Medicare cost over her lifetime, and assuming she passed 90. This one was for her Part D drug plan, and then her supplemental gap plan. This one was for additional costs, and then her total costs would have been this amount. So as you can see, this is the healthcare cost. This is not long-term care costs. It can be quite expensive. If you live a long time, the costs will most likely just go up. So as I said earlier, if you want me to have your own report run, just fill out the information. You can leave the thing with me and I'll have it. Make sure you give me your email or whatever, or your phone number, and then I'd be happy to get it back to you. So again, and just closing, so we'll have some time for some questions and answers. Again, don't wait too long. Just bite the bullet and get it done. And you can then move on with the rest of what you want to do for life. And then also, it really helps avoid delays. If the time comes when you need it, your family, and you should share where all this information is and where the policies are and who to contact. It really avoids a lot of delay and costs, and it really keeps the family together rather than having just panicking, trying to figure out how to care for you or your mom or dad. Again, make it a priority, get organized, seek some help, learn, and always question also. Anything you learn or hear, you should question and check it out for yourself, and then modify your plan over time as you need. So for any questions, take questions either online or in person.
One question online. What is the adult care rate currently?
The question is, what is the adult care rate currently? On average in Texas, and it's going to be different for different states and different locations. If you're in a home care setting where a family has renovated their home and they're having maybe 2 or 3, 4 people in their care, and they become part of the family. I see a lot of like Filipino families do. They renovate their home and they have 2 to 3 to 4 people that become family members, and they feed them, they bathe them, they care for them, they do activities with them, but they need that care. They run maybe $2,000 to $3,000 a month. Okay, in a average level care facility, like a nursing home, I have seen it run anywhere from about $6,000 to $8,000 or $9,000, $10,000 a month. Plus additional costs if you want extras, like you want to go shopping, if you can do that, if you want your hair done, if you want your nails done, if you want anything special, you pay over and above what I call the rental rate. Okay, and as I said earlier, for memory care, that is the most intensive caregiving. If you have Alzheimer's and you kind of wander around and do all this kind of stuff, those memory cares and the nicer facilities, you're looking at $10,000 to $15,000 a month now, and I expect the cost to go up.
I have a question. So for the long-term plan, they have like a maximum that they will pay out, the coverage?
The question is, for the long-term care, I guess, of any type of plan, is there a maximum that they will pay out? The applicant will purchase the coverage they want. So some people will say, I only want the equivalent of $2,000 a month for 2 years or 7 years or 5 years or whatever, with or without inflation riders and this kind of thing. I've seen some where you can apply for, you can say, I want $50,000 a month. In other words, you buy and purchase what level of maximum you want. And then people will ask me, well, Karen, what happens if we go through all the money? I said, well, then you got to figure out what you're going to sell next. What are you going to sell or use next to pay for the care of that loved one? And that's where they start, like in my mom's case, we just thank God that she told us all what she wanted. we were able to manage. My sister took care of her. That really took a lot of the cost down, let me tell you. But I had it set up where we paid my sister for caring for my mother. So it was a win-win situation. She lived, how Chinese family, they have 3 generations in one home. That's how our family was. So they lived upstairs for like 20, 30 years. Mom was downstairs. It was mom's house. The kitchen and the dining room and the TV and all stuff were downstairs. So it was a united family. So when mom became incapacitated, I proposed to my sister, if you care for mom, I'll pay you such and such a rate out of mom's pocket. I made her a W-2 employee of my mother's trust. So my sister, who had never really worked, because once she got married after she finished school and she did some internship at, she was a social worker by training. But once she got married and was having children, she never really officially worked. So she never secured Social Security credits. So I said, tell you what, sister, hire you as an employee from mom's trust, pay you, and if you need more, you tell me. And then that way you're going to qualify for Social Security quarters and the Medicare, all this kind of stuff. And she took care of mom for 17 years. She got more than her 40 quarters. Okay. But her husband made him a lot more. So she would qualify on his anyway, but still she was able to do that. And at the same time, she gave mom the very best care. Okay. So,
So do you have to show the proof that you pay someone? Do you have to show that proof to the insurance?
yeah, if you purchase a traditional long-term care policy, as I had mentioned earlier, one of the negatives about it, it's a reimbursement policy. Someone in your family would have to pay out of your loved one's pocket first, then submit all the receipts for reimbursement, and they will filter it and they say, oh, this one's good. Okay, we'll pay that one. This is not that. Nope, no reimbursement. Oh, this one's good. This one's good. This one's good. Oh, not this one. So in other words, they're going to filter all your receipts, and then they will decide by their criteria if those expenses are reimbursable or not. Now, and you also have to use qualified trained caregivers. You couldn't just hire the kid next door to come clean your house or do whatever. Now, when you purchase a hybrid, the life insurance with the long-term care rider, those are the hybrid plans. You can actually hire anybody you want.
You can hire my husband.
You can hire your husband, yes. As I said, I typically don't suggest that you hire your spouse, and here's why. I'll tell you why. And it's amazing how I find many spouses, sometimes the man is like, one hit and you're down, and he's big. And the wife is this petite, tiny little thing, And usually it's the wife that the wife that will need it, but that husband needs it. Okay, so I'll tell her, I don't care what size you are. I want one of you to lie down on the floor right now, and the other one pick them up. They can't do it, and they're still healthy. So I usually suggest when you purchase any kind of a policy, don't use the money to pay yourself to, work yourself to death. You use that money to hire someone else to do all the work, but you oversee them to make sure that they're not being abused, stolen from, and being perpetrated fraud on. And so you check and monitor and make sure your loved one's getting the best care. Now, if the person truly want to physically care for that person, no problem, because I know they're going to knock themselves out, do the very best that they can, like my sister did for my mom. Okay, and that would be agreeable as long as that person's agreeable and they can do it. And my sister's 4'11", 85 pounds, and she was smaller than my mother, but she knew how to lift and she knew how to rotate my mother, from side to side to aerate her back and her body, so she never had a bed sore in the 17 years. Yeah, good question.
So Karen, for the life insurance with the long-term care rider.
Mhm.
So if you don't use your long-term care
Mhm.
and then you die,
Mhm.
so that money will go to your beneficiary.
Yeah, the question from Amara is, if you have a long-term care hybrid plan, or life insurance, or a long-term care rider, if you never use it, then yes, when the person passes away, the beneficiary is going to get the life insurance death benefit. That's why it's called a use it or use it policy. Okay, so that's why nowadays I'm seeing, in my opinion, that's the better way to go. Okay, now, like I said, if you're convinced you're gonna use it, then I don't care which kind of policy you get. Just make sure you use it, because most times you will pay back, you will recoup your premiums in 3 months of using it. You do the math, it takes about 3 months and you recoup all your premium costs.
I have a question. If we have whole life insurance and the death benefit, we can use for the what they call the very ill situation. In that way, do we still need to buy long-term care?
That's a good question. The question is, if they have a whole life policy and then they become, I guess, ill, and if they use it, can they use it in that situation? No, the person has to die. So if you need the long-term care, you're already dead. So you won't need it anymore. But the beneficiary will get the whatever the whole life policy. Now, I have not seen yet where you can tack on a long-term care rider to a whole life policy. It changes the computation of the whole life policy. I only see the long-term care rider on a life insurance when it is it's a universal life. It's a kind of a hybrid type of a life insurance policy, but I've never seen it yet added to a long-term care policy. More recently, I've seen some term as well as a permanent but not whole life policy. They have added on some features where you can have chronic illness or acute illness, but it's a very limited benefit that you pay a little fee and then you can extract out like $25,000, but that's not going to take care of much of long-term care costs. But that's a good question. Yeah, so life insurance for the whole life, I have not seen long-term care riders added to it. Now, they may exist. You would have to check with your advisor, whoever you work with, but I have not seen that to a whole life policy, but I've seen it on other policies.
Yeah, actually, I have discussed with the insurance lady, and we discussed about this long-term care issue for a long time, and then she said that since the death benefit can be like you can loan out to use it, and as long as you last, I mean, say if you have a 1 million, and then you can left like a
Long term is different.
10K or something for your death benefit, what I call
Yeah, that
beneficiary.
yes,
And then
that actually is a good point. The comment here is that this lady here online is saying that she and her agent have discussed on I guess a whole life. You can loan out some of the cash in the policy and use it for your care. Actually, yes, you can. Now, here's how it works. That's going to be called withdraw to basis. You're gonna and let's just make sure, pretend as your example is that you have $1 million of a whole life policy, and let's pretend you put in X number of dollars of premium over this whatever period of time. Okay, you haven't paid it all the way through to age 100. I don't know how many years you're paying into that type of a policy, but usually you're paying for your whole life. And so you're building up cash in it. So if you take cash out of it for whatever purpose, yes, you can, but you're going to lower your death benefit. So if you take out $50,000 for that years of care, your $1 million is going to be less by 50,000. And then if you take out more, you're draining your policy. Now, there's also something like withdraw to basis. I know in loan provisions on policies, you can loan it, but you can loan and it comes out cost basis, no tax implications if you're taking out your original premium money. Once you go into any of the profit or gains of the policy, you're not going to pay income tax on the gains. So you have to be very careful. Again, the type of policy you purchase, you want to make sure it's the most cost effective that you're able to purchase. But if that's the only choice and recourse you have, then it's better than nothing.
Okay,
There's a question online. since you mentioned about the term life, that kind of life insurance, what's the difference between term, universal, whole life, and permanent?
Oh, very good question. What's the difference between term life, universal life, and some kind of permanent or whole life? Okay, I'm gonna stack it up in terms of cost. And let's say we're all going for $1 million and you're a healthy young person. Okay, term is going to be the least cost, but you're only going to rent the protection for let's say 30 years. So for 30 years, you get approved and you're paying for the million. And let's say you're like 28 years old, I'm making that up. You're going to pay like maybe not even $1,000 a year. Okay, very, very good. But at the end of the 30 years that you rented the protection for 30 years for $1 million, at the end of the 30 years, that premium is going to jump exponentially up. And if you're foolish enough paying to 95 and you pass, at 94 or something, okay, and you had to purchase a $1 million of coverage and you're now about 94 and you're goofy and you kept paying for it, you have now paid about $7 to $8 million for that $1 million. That is how high your premiums will jump after you come out of your rental period. That's term. Term is very appropriate for just starting out for young families. Great need for protection and coverage. It's wonderful. Pay off the mortgage, get the kids out of college, pay off an obligation loan or whatever. That's fine, no problem. But usually over time, then the needs for life insurance change as you get older. You may have purchased a second home or you have business obligations. And so then you want a permanent one. So you can actually do a conversion of a rent to own where you convert your term policy. It's like flipping a house, it's a rent to own option. When you rent a house, but they have rent to own options, you can then convert it and purchase a permanent policy, which then would be what we call a universal life policy. There's two kinds. And whenever I talk to my clients, I tell them, I'm going to push you to get the guaranteed one. The non-guaranteed ones might be a few dollars less per month on the premium, but they can't guarantee you that it's going to last to the ripe old age of 100 or whatever you're hoping to, make it go to. And I've seen enough letters coming from all these different companies that I'm referred to from other offices, and they refer me these clients, and they're getting these letters from the carriers saying, oops, we miscalculated the interest rates over these many 20 years. And there's not enough cash and there's not enough interest return. So you're going to pay more premium or your policy is going to lapse. But that's the non-guaranteed universal. Now the premiums may be a little higher than a term. And they hope that it goes to whatever ripe old age that you want to make it to. That's the non-guaranteed one. The guaranteed universal life is a little more premium, but that one, assuming the company's still alive and solvent when you die, the premium is a little more, but that one should guarantee the policy to last. As long as you pay your premiums on time, it guarantees to like 70, 90, 100, or 120, whatever you make your plan go to. Okay. Now, in my sister's case, she bought the guaranteed universal. She tacked on a long-term care rider. Her thinking was she loves her 4 boys dearly, and she wants to make sure that they know mommy loves them. So she had long-term care policy, but she also wanted to make sure, in addition to the house and the pension plan, all this and the other, that they had extra money. So she put a life insurance with a long-term care rider on it. And then when she retired, she said, as she was planning to retire, she said, Karen, you know what? I don't want to pay for life insurance premiums with long-term care when I retire. That's just an ugly thought. So how about we recalculate it and make it so that it goes, finishes, and it's going to last to my age, 92, 93, whatever. And that it's guaranteed to last until that point in time, because I expect to pass away before then. I said, okay. So I had it recalculated, and so now she paid it all up. And so she's got the life insurance with the long-term care, plus she's got a regular John Hancock policy. That's a very good one, let me tell you. And so that the boys, her 4 sons, will know that mom loves them. Now there's a variable universal life. There's a VUL. You see how the premiums get a little higher and higher for the same amount of coverage. The VUL is, you put more premium in, and then the surplus that doesn't cover the cost of insurance, the admin and overhead of the insurance company, it goes into the stock market into what we call sub-accounts, kind of like a mutual fund sub-accounts. Now, I would suggest people that do the variable universal flexible premium, whatever, life insurance, the VULs, I'm going to tell you straight out from the get-go, you're going to have to pay many years, a lot of money, more than the recommended, more than the suggested premium, and you're going to pray that the stock market doesn't go down. Because if the market goes down and it takes your account down of your sub accounts, and you're not able to cover the cost of insurance, at some point you can lose your coverage. And this is what we have seen in 2008, when a lot of those VUL policies were being sold in the early 2000s. And the clients were putting just minimal amounts of premium in, stock market went down, cost of insurance was more, the coverage all lapsed. And so let me tell you, there are a number of lawsuits. So whenever I work with clients for that part of their financial planning, I say, unless you're really going to put a lot of money and you're going to pay for at least 10 years, lots of money in, and you're going to pray that the stock market does not go down regularly, then you can do it. But otherwise, I would suggest do not do that. Thank you. Now, whole life is a different one. You see how the premium's higher than all of them? Whole life is basically you're funding that policy, say for the $1 million with your own money. It covers cost of insurance, admin overhead, and mortality and expenses and all this kind of stuff. But what's happening is your extra cash is going into it. Insurance companies also putting a little bit of interest in there, not much. And then by the time you reach 100 for that $1 million policy, you should have $1 million of cash in it at the time you're 100 years old. But by then you'll be so old, you won't even know what's going on. So someone else is probably going to benefit from that policy and not you. So if there's, but in all fairness, during the Great Depression, our parents, grandparents, they only had term or whole life. That's all they had. So term actually came later, but whole life. So when the Great Depression happened and a lot of the banks failed and they closed down the banks and they couldn't get their money out, many of our older generation did not trust banks at all. They used their life insurance policies as their bank. So they would take loans and withdrawals from that, from the policy. So it kind of became their little bank. Yeah. So I hope I answered your question. Term, non-guaranteed universal, guaranteed universal, variable universal life insurance that is in the investment. Don't do it unless you're really rich. And then whole life. I think we're done, but you can always, you have my email, you can email me questions and do what you need to do.